please, Dr. So, Dr. Jung-Yul Park is the Vice President of the Korean Medical Association, former Chair of the World Medical Association Finance and Planning Committee, Vice President of the Korean Academy of Medical Science, Director of the Korean Authority for CMEs, CPD, Implementation Evaluation, Professor in the Department of Neurosurgery, Medical Humanities at the Korea University College of Medicine, and Director of the Spine Pain Center at Korea University Annam Hospital. Thank you very much, please.
Thank you for kind introduction. You spend my half of my time. My allocated time is 5 minutes. And it's not Jung, it's a Jung Park. So friends call me JP from South Korea. Officially, it's Republic of Korea, rock without sea. So you can call me JP. So I'd like to get started. Before I started, thanks for having me here. It's a wonderful conference with wonderful people I met last 2 days. I'll be staying until Sunday. So although I only have 5 minutes, I'd like to start my first minute. If I can, do I have a control? Okay, so I got it. So I'd like to start my first minute, what I've learned about Israel. I thought that South Korea was a small country, but I found out it's only 1/5 of my country, of the population and the size. However, the differences are many. If I can just list a few of them, GDP ranked 28th, but if the per capita is 14th as of this year. South Korea is 30th, and people, Israelis living in Israel and abroad, 0.2% only, but more than 20% Nobel Prize winners. And very impressive facts, #1 startups, that is 1 per 1,500 persons. Very impressive. And some of the innovation we have seen yesterday, someone was talking about a capsule endoscope, which was actually made idea from missile warhead, the optics, and many others. And 8th most powerful country, and I like this the best, 9th happiest. Is this right? No way. 9th happiest country in the world, more museum than any other country. And chutzpah, someone told me there's a founding and challenging spirit. We have a hungry spirit in South Korea, and many, many others. So we also, males in Korea have to serve 3 years of the military, but the difference is they do so much things in Israel. I think that this one I have to bring back. So one of the index I found out, Global Innovation Index in general, the South Korea ranked 6th, Israel 16th, but when you look at the healthcare innovation, Israel ranked 5th, I think 2nd, this year, most likely, if I'm right. 14th, South Korea, so it's in reverse in order. So there must be some reasons that South Korea has very high rank innovation, but healthcare innovation, I think we still have to learn a lot more from Israel. So I was asked 2 questions, one before I took off, one after I found out that I won the program. The first one is the opportunities and challenges related to development of healthcare innovation that brought to my country. So it's my thought, and I think it applies to most of the countries. So I will not go over everything, but and they're not order of the importance, but of course the great promotion of the healthcare service, and it increased a great deal about life expectancy. This one I think we can beat Israelis. The average age, life expectancy is 83.5. Sadly, not sadly, but luckily, female live about 6 years longer in our country. And there are many others with the opportunities that we can think of. I listed, to be consistent, 14 opportunities, 14 challenges. So you can read them. If anyone wants it, I will send it to you. So I'll just skip this one. But challenges, I think there are quite many challenges in Korea, as well as many other countries in South Korea, the Southeastern countries. Increase in burden for the learning and training, especially you see elderly, a senior physician in the program. I am age of 64, but I didn't have much problem with the elderly, as an elderly physician, learning, training this new technology. However, there was, and still, a surge in the medical cost. And we have to, especially during the pandemic, we had to recruit many healthcare providers. And interestingly, there was some decreased number of resident applications, many the areas, unlike to Israel or Western countries. And very steep rise in number of other healthcare workers like a PA, which have many conflicts in Korea. And other challenges, medical efficiency, equity, and conflict interest in medical ethics, and risk of security breaches and responsibility issues that we see everywhere in the world. And as an educator, we had to have frequent reform in education, in curriculum in medical schools, postgraduate, and CME and CPD. And sadly, there has been sort of a disappearance of traditional golden standard approach and too much device-oriented and procedure-based practice. I think my time is already up, but I'll try to maybe have an extra minute because there was a long introduction. Many other challenges, and one of the one I'd like to mention is number 11. There is a large gap between the expected life expectancy and healthy life expectancy. Recently, we had the survey showing that there is up to 17 years of difference, just life expectancy and healthy life expectancy in Korea. So this is one of the many problems, I think. And the other question I just found out is that the future of medical innovation and how I expect that it will affect our medical the profession in coming years. I also listed 14, just to mention a few. We have talked about the increased importance of data, like electronic patient health records, and I think that there will be shift paradigm of cure to care to lifelong total care that we are responsible as physicians. And there will be boom in anti-aging medicine and many other areas related to geriatric or gerontologic medicine, especially not only the elderly patients, but elderly physicians like me. And super intelligent, we talked about AI and advancement of telemedicine, although it's a quite early stage in Korea because of the political, the conflict between politicians and physicians in Korea, especially the primary care physicians, because they worry too much about the big giant the healthcare providers like Samsung and Hyundai, and the other ones are like it's not anymore of physician-centered or patient-centered. I think it will be the person-centered. It means that we have to take care of not just the patient but everyone related to the healthcare. And others one that we can think about shift in education and training environments, as some of them mentioned. Advanced simulation-based curriculum, which will be and already became the mandatory. And difference is that it's delivered in a flipped pattern, not like a traditional education systems. So there will be no more sort of a lecture. It's only playing games and simulations. And there will be, I think, the automated self-care at home with the fancy sort of a sophisticated the wearable devices, and shift in physician job types and job descriptions. And there is already in Korea, there are like exclusive the care specialist, and they only care about these patients with the telemedicine. And however, in the government side and the political side, there are more the strict regulatory guidelines and the government control over this healthcare innovation. And another sad the finding is a disappearance. It's border of medical and healthcare professionals and increased number of young doctors migration to other countries. So these are some of the covers from time. Many related to the healthcare innovation, but most worry about they living until age of 100 without regrets. So I think this is the key point. We can't make people just live longer, but live longer, make people live longer without regrets about living too long. So that's another challenge. So there's a famous quotation from Africa: if you want to go fast, you can go alone. If you want to go far, we have to go together. And like meeting like this, I think it's time to, we need more the communications, collaboration, and commitment together to be ourselves as leaders of the healthcare professions. If we can make a road, the travels will be easy and more fun. So I think there's a lot of promising future in ahead. So I'd like to finish on my last slide. Thank you very much. I think I don't have time for the question and answers, but if you can come up with personally after, I'd love to.
Maybe you stay and we'll ask.
Oh, I'll stay here?
Yeah, and then we'll ask Dr.
Is that a punishment?
No. You are my good friend. That cannot happen. I don't do that to my friends. No, I meant to say that maybe we'll have you, both of you up and after the presentation, and then we can take a couple of questions for internationally, okay? So.